Introduction. Postpartum depression, PPD, is characterized by prolonged low mood, sadness, feelings of worthlessness, and despondency. PPD is different from the temporary condition known as baby blues, which affects many women shortly after childbirth but typically resolves within 10 days. Definition. PPD is defined as a depressive episode associated with childbirth. According to the DSM-5, it can begin during pregnancy or within the first month after delivery, while the ICD classifies it as starting within the first 6 weeks postpartum. Some research suggests extending this period to 6 months or even up to a year after childbirth. Symptoms. PPD shares many characteristics with other forms of depression, but is unique due to the significant changes that occur during and after pregnancy. Symptoms include changes in appetite, difficulty sleeping, low energy, and emotional disturbances. In severe cases, symptoms can last up to 2 years postpartum, with variations in severity and duration. Common symptoms include sadness, irritability, feelings of worthlessness, loss of interest, anhedonia, insomnia, and suicidal thoughts.
PPD shares many characteristics with other forms of depression but is unique due to the significant changes that occur during and after pregnancy. Symptoms include changes in appetite, difficulty sleeping, low energy, and emotional disturbances. In severe cases, symptoms can last up to 2 years postpartum, with variations in severity and duration. Common symptoms include sadness, irritability, feelings of worthlessness, loss of interest, anhedonia, insomnia, and suicidal thoughts.
According to paper published in 2013, postpartum depression, PPD, is common among women in Pakistan, with a prevalence rate ranging from 28% to 63%, placing it among the highest in Asia. A study was conducted in 5 populous cities of Punjab from January to June 2023 by administering the questionnaire to the women using stratified random sampling. A total of 3,220 women in first 6 months postpartum were screened using the Edinburgh Postnatal Depression Scale. Of them, 1,503 women scored 13 or above, indicating potential depressive disorder.
According to article published in Innovations in Clinical Neuroscience in 2019, PPD can also occur in fathers. There are no established criteria for PPD in men, although it could present over the course of a year with symptoms of irritability, restricted emotions, and depression.
PPD can have serious effects, often mirroring those of general depression but with more pronounced consequences due to the specific challenges of childbirth and motherhood. It can cause persistent sadness, feelings of worthlessness and guilt, anxiety, irritability, changes in appetite, difficulty sleeping or insomnia, low energy levels, poor concentration, physical complaints without a clear medical cause, poor bonding with the infant, recurrent thoughts of death or suicide. PPD can persist for up to 2 years in about 30% of affected women. It may develop into major depression throughout the postpartum period, with varying levels of severity and recurrence.
The risk factors for PPD. 1. Strongly associated factors. Depression and anxiety during pregnancy. Postpartum blues. History of depression. Neuroticism. Excessive stress from life events. Poor marital relationships. Lack of social support. Low self-esteem. 2. Weaker associated factors. Low socioeconomic status. Single marital status. Unwanted pregnancy. Obstetrical stressors. Challenging infant temperament. 3. Additional factors. Attitude towards parenthood. Complications such as preterm delivery, prenatal hospitalization, emergency cesarean section, preeclampsia, and poor infant health.
Questions we need to ask ourselves. Why we rank the highest in Asia in PPD? Is it because of low socioeconomic factors? Are we not having planned conceptions? Are we actually ready for parenthood? Do we understand the responsibilities that come with getting married and being a parent? Are we too preoccupied with being good at job, in-laws, friends circle and society in general that we are ignoring our own needs? So much that we are too tired for parenthood? Are we understanding the actual economics and expenditures of having a kid in current times? Let's just take a look inside and ponder on, before it's too late.